Hi, Alan. I'm very happy to welcome you here again in Leuven. I think if I'm right, this is already your third course for Smart Education here in Belgium. Is that correct?
Absolutely right. It's very good to be back again. I really enjoy working with Smart Education because you look after me very well. And I think you look after the delegates very well as well.
Okay, it's very nice to hear. Up till now, we're, I think, halfway the course. It's lunchtime now. What did you think of our brand new course location and the participants up till now?
The venue is great. It's a really nice venue. It's a nice space. It's light. It's airy. Audio-visual facilities are all great, and there's plenty of space for the delegates. They've all got their own bench, so it's great for the practicals as well. I think the delegates have been working at a really high level. They've been asking lots of great questions. It's really good to be challenged, to be asked all these difficult questions and make me think, so that's good. As to how it's going, I think you'd probably have to ask the delegates that rather than ask me. But from my point of view, it's going fine.
Okay, nice to hear. I think if I can see the delegates up till now, I see only happy faces. So that's already really good to see. If you're speaking about the delegates, maybe let me ask you, what is your target audience? If you would describe the ideal participant of a course, because we see neurological therapists, manual therapists, MSK therapists. Who is perfect to be here in this course today?
Basically anyone. I think I always feel a little uncomfortable dividing therapists up into these boxes, because to me, we all work with restoring normal movement and normal function, and how we do that doesn't really matter. And in the case of sort of vestibular courses, I think the whole area of vestibular physio overlaps all of these individual fields anyway. So it's an ideal mix to have neurophysios, musculoskeletal physios, elderly geriatric physios, community physios. It really doesn't matter. I think as long as you come with an open mind and a willingness to try some new things, that's great.
Okay, very nice. So if I put this short, it's like for a very broad public, and a lot of therapists could benefit from what you're telling us today.
I think so, because dizziness is very, very common. It's widespread, and most therapists at some point in time will come across dizzy clients. Either the patients will come directly complaining of dizziness, or it might be that you have a neck patient and you find that you can't make progress with your neck treatments until you look for an underlying cause. And often it might be that there's an underlying vestibular dysfunction causing the high neck tone, causing the neck problems. So it really doesn't matter where you come from. I think everybody can gain a little bit from this. And certainly for the introductory level course, anybody can turn up, anyone who's got some therapy training, or osteopathy, or chiropractic, or medical training. For the follow-up course, I think it's good to have some experience. I need people to already seen a little bit about what works and what doesn't work with the clients.
Yeah. Okay, that was a little secret we were going to reveal today, because indeed we're organizing like a level 2 course of this course, because a lot of participants were asking, even during the course and after the course, if there were some more advanced courses. So I'm happy to tell everyone that there will be a level 2 course. Can you tell us something more about that course? What will people be? What could they expect from the course?
First of all, to be challenged. It's gonna test them, but I think it's very helpful to once you've experienced work with dizzy clients, you will realise that some of the things we talk about in the introductory level course in the real world are not quite as clear cut, and we come across these complicated patients who don't fit into neat boxes, and there we have to think. And I think the main thing with the follow-up course is getting people to think around problems and realize that many of the complex patients are to do with multisensory processing or integration. And so rather than focusing purely on one sensory input, be it vestibular or cervical proprioceptive or visual, we realize that the problems lie in the brain's putting together of these different inputs. And so we have to adopt a multisensory approach to the patient, looking at lots of different avenues. So I think we will challenge you that way. We will look at cervical dizziness in quite detail, the limitations of talking about cervical dizziness and how we can best fit it in with other vestibular assessment and treatment. We'll look at the more unusual or atypical benign positional vertebras with the wee crystals which rattle around in the skull. We'll look at the lateral canals and the anterior canals and alternative treatments for posterior canal BPPV. And again, we'll look at rehab for the client, but based very much on the client. So getting away from the idea of recipes, getting away from the idea of diagnoses and diagnostic labels, and basing our rehab upon the client so that it's always appropriate and progressive, and using our clinical reasoning skills rather than just a guideline or a set of recipe instructions. Apart from that, they should have some fun. That's what you can expect.
Yeah.
Be challenged and have some fun.
Of course. But I think they will. If I see the participants today, I think they will have fun. And it sounds really challenging, the level 2 course. So we're really looking forward to it. I can already tell that the course is already online. So if people are interested, they can check our website. I can tell you, Ellen, that I'm already very curious about part 2 of today. Mm-hmm. And maybe we should head back and go see the participants again.
They'll be itching to go.
Yeah, thank you for the chat.
Thank you very much indeed. I'm looking forward to coming back to Smart Education again.
Okay, thank you very well.